لیےڈیگاس oral drops, comprehensive clinical guide. Product name: لیےڈیگاس oral drops. Brand type: pediatric. OTC/prescription, depending on local regulations. Dosage form: liquid drops, oral use. Volume: commonly 30 ml bottle with dropper. Manufacturer: varies by country. In Pakistan, typically manufactured by companies like A or Nabi Qasim Industries. Composition: per ml. Simethicone 40 mg/ml, typical strength. Mechanism of action: how léědégas works. Simethicone, the active ingredient in léědégas, is a surfactant used to reduce bloating, pressure, and discomfort caused by excessive gas in the stomach and intestines. Mode of action: Simethicone lowers the surface tension of gas bubbles in the GI tract, causing them to combine into larger bubbles. These larger bubbles are easily passed through belching air flatus. It is not absorbed systemically, meaning it works locally in the gut without entering the bloodstream. Indications when léědégas is used. Léědégas drops are used for infants, children, and adults to relieve infantile colic, gasiness and bloating, flatulence, gas pain, air swallowing, functional dyspepsia, gas discomfort, overeating or gas. It is especially useful in infants who cry excessively due to trapped gas. Pediatric use. léědégas is most commonly used in babies, 0-12 months, and children, 1-5 years. Its safety profile and nature make it ideal for this age group. Common use scenarios: colicky infant crying at night, gas buildup after feeding, burping issues, abdominal distension. Dosage administration: always follow physician's instructions or label directions. For infants, and under 2 years, 0.3 ml to 0.6 ml, as directed, after each feed. Can be used up to 4 times daily. Children, 2-6 years, 0.6 ml to 1 ml 3 to 4 times daily. Children over 6 years and adults, 1 to 1, 2 ml after meals and at bedtime. How to administer? Can be given directly via dropper or mixed in milk/formula. Shake well before use. Packaging and appearance. Bottle: 15 ml or 30 ml amber glass bottle. Dropper provided for accurate dosing. Often comes in a box with product insert. Precautions warnings. Do not exceed recommended dose. For oral use only, not to be injected. Ensure clean use of dropper to avoid contamination. Do not use if the child is allergic to simethicone or other ingredients. Consult a pediatrician if symptoms persist beyond 1 week. Contraindications: known hypersensitivity to simethicone, severe gastrointestinal obstruction, perforation or peritonitis, requires emergency care. Pharmacokinetics: absorption, not absorbed in the GI tract. Distribution: acts locally in the gut. Metabolism: not metabolized. Excretion: excreted and changed in feces. Pregnancy lactation. Pregnancy: